Danielle Houston. I'm the host of this podcast, The Checkup. I am also a benefits advisor at Lockton Companies. We have had sort of this ongoing series meeting different experts within Lockton. And this morning, I am really excited to introduce you to Scott Behrens. Scott sits in our Kansas City office, and his role is one of, well, I find great importance in it. I love legislative work in general. So Scott is the person who is our Director of Government Relations. He's been with Lockton for 7.5 years. And when he first came aboard, it was as an ERISA attorney serving on our compliance team. So he's experienced that whole spectrum of working with something after the policy has been passed and helping clients implement all of those next steps. When Lockton realized that we were at a size and had the client base that really required and needed someone to be involved as the policy was actually being written and not just engaged in the afterwards, that's when Scott stepped into this role in government relations. And it's been a couple years now. Is that right, Scott?
That's right. Yes, it has.
And I would love for you to share with us what was exciting to you about that change. Why did you feel like that was the place for you and really wanted to step into that role and away from the compliance piece?
Sure. I think as you noted, I am an ERISA compliance attorney by training. And if you don't know, ERISA compliance attorneys are not the most fun at cocktail parties. Little bit more activity around government relations. And so, one could say that I tried to move over to GR to up my cocktail party game. But I think, historically, part of my background before I went to law school, I worked for a congressman, have a politics degree. I've always enjoyed being involved in policy. And I think really, seeing two pieces of policy. One, the policy making portion, which is really proactive and working with lawmakers who oftentimes have very limited understanding of, at least in this context, employer-sponsored benefits. And so oftentimes seeing on the other end, on the compliance side, reacting to laws and legislative action, regulatory action that, had unintended consequences. And so wanting to be part of the sausage making process to make better sausage, if you will.
Yeah, I think that's a really great description. And also, that proactive piece is something that you and I spoke about as well, because there's something so frustrating about going to your client to tell them what they need to comply with next, and also having to deliver the message, well, it's too late to have a voice right now. Everything's been done. So now we're at implementation. Having this space where there is an opportunity to be heard before everything is finalized is really exciting and I think empowering. So, I hope that our clients are excited about the fact that we do have a voice there and that you care about hearing those voices.
Absolutely. I think, for me to do my job well, I need to know what is going on at the ground level, what employers are struggling with, what employers would like to see, and being able to take that information and translate it into, legislative speak to help our lawmakers in the other Washington know how to make good policy.
On the checkup, we talk a lot about what's happening in Washington state. And as you know, there's tons of activity on the state level here in Washington in particular. But there's also a lot happening in the other Washington. So how's the climate there?
Yeah, I mean, You watch the news, you see the reports, and you see all the infighting within the Democratic Party, and then you see all the mudslinging between Republicans and Democrats. And I would say overall, things have become increasingly more political. Just listening to speeches, talking with lawmakers, hearing how much more politics is impacting things. So there's still quite a bit of divisiveness, but I think overall, I'm relatively optimistic about things. There are still a lot of lawmakers who are working hard to try to get things done. We see so many of the big picture, things that are happening. There's several things right now that are taking up most of the news, but there's a lot of work happening, lesser bills, smaller things that we don't think of as much, and a lot of bipartisan support happening for those.
Well, bipartisan support is always promising. It's nice to know that there are areas and places where people are working to agree and get things done. So, I'm going to ask the question, and I'm asking the question partly here too, in a way that I know the HR pros that are out there who are just under the burden of vaccine mandates. Is there anything else happening besides vaccine mandates in Washington, D.C.?
Oh man, yeah. If I can get away from talking about vaccine mandates for a little bit, I am pleased to do it. We've got Paula Day who can help with that. In DC, there's really right now the four major things that are impacting policy and potentially impacting everybody who's listening to the podcast. One of the big things that just got resolved was funding the government. There's going to be another need to fund the government, prevent a government shutdown before December 3rd. So we've got that going on. We've got the debt ceiling, which is a huge deal, whether the United States is going to start defaulting on some of its debts. It's looking like the drop dead date to, quote, raise the debt ceiling is October 18th. If they don't, there's going to be huge impacts on financial markets, on insurance markets. And then we've got two major pieces of legislation, about a $1.2 trillion hard infrastructure package that is passed the Senate on a bipartisan basis and is sitting in the House, sort of being used as leverage for the fourth piece, which is the Build Back Better Act, which is a pretty expansive initial draft was $3.5 trillion piece of legislation that touches all sorts of aspects, from paid leave to the ACA employer mandate to early childhood education and green energy, all sorts of things going on in that package. So those are the four main things that we see going on right now.
Four big things. So let's really look at this Build Back Better Act. And I know you'll get to it, so I'll just wait. It's just interesting, though, to see paid leave come back up. Not terribly surprising, because back in 2020, before the world, tipped over, there were a lot of, we were basically all betting that paid leave on a federal level would likely pass that year. And then, of course, COVID redirected all of the energies for the rest of that year. So it's interesting to hear that pop back up. Do you want to start with the employer mandate?
Yeah, so the employer mandate, this is the rule under the ACA that says any large employer has to offer their employees, their full-time employees, coverage that is both minimum value and affordable. When we do the affordability calculation, it's based on 9.5% subject to inflation of the employee's household income. What the Build Back Better Act would do, it proposes to reduce that down to 8.5%, effectively at least for some employers, requiring that they pay more, subsidize more of the premium cost for employees. There's also a provision in there that would say for any employee who is making less than 138% of the federal poverty level, it used to be, or under current law, it's 100%. They would also be eligible for subsidies, even if the employer did actually offer them minimum value and affordable coverage. Now, the key with that one, though, is that normally if an employee triggers, full-time employee triggers or gets a subsidy, that is what triggers the ACA employer mandate penalty. We've talked to legislators about that. And so in the Build Back Better Act, those employees in that 100 to 138% of the federal poverty level wouldn't trigger penalties under the ACA, but it will make ACA reporting a little bit more of a challenge. And anybody who's gotten those wonderful 226J notices will have probably a little bit more work to convince the IRS that a penalty should not be levied.
Got it. When is the date that you think this might all end up in our collective laps?
So right now, the effective date on that is January 1, 2022. As you're very aware, employers right now are going through the process of setting their premiums for the year. And so we've been talking to lawmakers about that and, helping them understand that, employers can't just flip a switch on January 1, 2022. So we've been pushing for the first plan year beginning after January 1, 2022. So.
Good. Yes. I mean, so many employers have already pushed out what their premium contributions are going to be for their employee plans. Okay. How is the Build Better Act going to influence pharmacy prices?
Yeah, so this has gotten a lot of news lately. So one of the things that they're trying to do is have Medicare be able to negotiate for pharmacy prices. And essentially what they're doing in the bill is saying that Medicare can tie some of their payments for certain drugs to an international standard, and then also be able to limit the price increases on those drugs for how much Medicare is going to pay. So essentially, Medicare pays less for drugs. There's a provision in there that says that whatever Medicare pays for this list of drugs, that private plans, so employer-sponsored plans, would be able to take advantage of those same prices. So presumably lower the cost. The challenge here is twofold. One, there are several lawmakers Democratic lawmakers who do not want to see those drug pricing programs come into place. Even one of them voted against it in committee, essentially killing the provision in the current draft that we've got. It might get added back in, but the piece that probably won't get added back in is the piece that would allow employers to take advantage of those Medicare rates. So all of this discussion about how this act would potentially reduce prescription drug costs is really going to be focused on what Medicare pays and potentially not impact employers positively. It could potentially impact employers negatively in that the concept of cost shifting, where if Medicare is paying less for the drugs in order to meet earnings targets, the pharmaceutical companies might pass those additional costs on to private plans.
So what wasn't there to like about this part of the act from the lawmaker's standpoint who voted against it?
So actually, it's less about the politics or the policy or the people on this one. It's more about the procedure here. So under the typical rules to pass legislation in the U.S. Senate, you've got to have at least 60 votes for most legislation. There's a special rule that allows you to pass legislation with 51 votes. We've got a 50-50 tie in the Senate, Democrat, Republican, but Vice President Harris casts a tie-breaking vote. In order to utilize this special procedure, you've got to comply with all sorts of different rules, procedural rules. And one of those rules essentially says that you have to have every provision has to have a direct impact either on taxing or spending. The piece that would allow employers to take advantage of this, there was a ruling by the Senate, the parliamentarian who oversees the procedural rules, that essentially said that that provision allowing employers to take advantage of those negotiated rates does not comply with the special rules. It does not have a direct impact on taxing and spending.
All right. So a little loophole, which well, from the employer perspective, I can certainly, I was excited there for a minute because I did think, wow, there's really perhaps here an opportunity for employers to see some relief in pharmacy pricing, because we definitely, it's, the biggest area that we see increasing that concerns stop loss carriers and, us and everyone in between.
Yeah, absolutely.
Okay, paid leave. I'm interested in this one. And I know that this is a little fluid. So what can you share? Where do you think this might be going?
Yeah, so paid leave, as you talked about earlier, paid leave is something we've been talking about for a long time on Capitol Hill, having some type of federal standard. All the questions that states and local governments have had to deal with come into play at a federal level as well. And one of the big things that comes into play is the question of preemption. Would state laws, would local laws still apply, or would only the federal standard apply? So what the proposal currently looks like, and as you mentioned, this one is fluid. We've been talking a lot with lawmakers about making some changes to it. But essentially what it would do is it would set up a federal paid leave program that would essentially replace 2/3 of income, and that 2/3 would be reduced as income increases for up to 12 weeks. The ways to trigger the paid leave would be similar to FMLA, but would be a little bit broader. So it would apply to anybody after a shorter period of work. It would also apply to more people, maybe taking care of a spouse's parents or grandparents. And so it would be a little bit broader than current FMLA. And the key, I think, here for employers to understand is the benefit would be paid directly from the federal government. So your employees, what they would do is they would go to you and say, hey, I want to take this leave. Now there's an option to still run things through a state program, run things through an employer program, or to have the employee essentially petition the federal government, the IRS in this case, to say, hey, I'm entitled to this leave. Here's my documentation to show that. Pay me for this leave. So technically, there wouldn't necessarily be any new taxes or obligations on the employer, but there are ways for the employers to continue to run their own plans and states to run their plans. And I can go into more detail on that.
Yeah, well, it sounds like really this would be an area that we'd want to dive a lot deeper into as we know more, because things like how would the federal government fund it? And then, in Washington state, And in Oregon, we already have, legislation in place at a state level for paid family leave. And I think Oregon's actually goes into effect this January, but Washington's got a little bit of experience with this. So I think here, our clients and employers would be really interested in how things are going to, overlap and potentially work together.
Yeah, I think, right now, the way it's written, the sad news is it creates additional layers of administrative burden.
Yeah.
The federal rules try to ease some of that by providing states and potentially employers some subsidies to pay back the cost of that leave. But from an employer's perspective, uh, some of the burden is just not going to be worth the what it takes to get those subsidies.
Got it. Okay. Telemedicine and health savings accounts.
Yeah, so this is one I probably get more questions about this than just about anything. So you'll
Really?
recall, yeah, you'll recall last year during the pandemic, everybody staying at home, so there was a push for more telemedicine. As we know, if you have a high deductible health plan and you want to have somebody be eligible for an HSA, they can't get first dollar coverage or reduced coverage unless it's preventive dental vision coverage. Telemedicine is broad medical coverage. So, what employers wanted to do and what we convinced Congress to allow is to allow folks to go get telemedicine coverage, virtual coverage, without having to pay for each one of those telemedicine benefits before reaching their deductible. Congress put that in last year, but it only goes through the end of the 2021 plan year. So there's a lot of folks who are wanting to get an extension of that. Right now, it currently isn't in the bill, but there's some bipartisan support to get something in there. And so essentially what it would allow is for very low cost or no cost telemedicine coverage, even for people who want to be making contributions to their HSAs.
It sounds like a pretty smart and simple way to make healthcare a little bit more affordable and accessible to people.
That's the hope, especially out in the rural areas
Yes.
where, regardless of whether you've got a pandemic going on, uh, getting to a physical brick and mortar building can be pretty difficult sometimes.
Yes, major shortages of providers in certain areas. And I've talked about this a little bit on, some previous podcasts with the checkup, but my family lives in the rural Midwest and, in their county, there are few physicians, really to go see care that's beyond maybe some basic family or primary care. They're driving at least 45 minutes, sometimes longer. And that's hard for those of us, I think, who live in a more metropolitan area who have access to all kinds of different places in care, specialty and otherwise. So I have always loved that telemedicine provides such a great filler there, a great stand in the gap for lots of different kinds of situations.
Yeah, absolutely. And even, I've done physical therapy using telemedicine. And it's outstanding. It was
Yes.
something, hook up sensors to myself and, do the exercises and get a report back from the therapist. I could do it in a hotel room, wherever I traveled. And it just made it so much easier than having to drive over, even within the city, drive over to
Yes.
a physical therapist's office.
Yes, there's so much promise in technology and what we can actually deliver in the healthcare space. I love it. So, what are the chances of passage
Yeah, yeah. So, right now things are a bit mired in a slog. You've probably seen some of the discussion from the moderates in the Democratic Party versus the progressives in the Democratic Party, and how there's two key senators, Joe Manchin from West Virginia, Kristen Sinema from Arizona, who are really driving a lot of this process. What we're looking at, what we're expecting is for the package to get cut down some. Right now, started out at 3.5 trillion. It's probably going to be closer to 1.5 to 2.25 trillion. How they do that will be interesting based on some of those procedural rules. We've got to keep an eye on how much the bill adds to the deficit outside of 10 years, so they can reduce the time period of the programs, expecting or hoping that a future Congress will extend them. One push is to do more means testing, and so make it so fewer people, the wealthier you are, the less likely you're going to get free childcare or free community college for a couple of years. So means testing is another way to bring it back. So all of those things are being worked out as we speak. There's conversations every single day about them. As I go around and talk with Democratic lawmakers, they feel a lot of political pressure to do something and do something big here. So they feel like that is on their backs, and if they don't, they're going to pay a political price for it. And then finally, there's a lot of policies in here that have been Democratic policies for a long time. They see this as the opportunity to get those policies put in place. So when you look at the people, when you look at the procedure, when you look at the politics, the policy, the 4Ps, there's certainly some challenges around all of them, but there's momentum behind them. So I would still say that chances are we will see some type of significant package that will include at least bits and pieces of all the things that we just talked about within, I would say, we're still looking at sometime before the end of the year, but it could come together even quicker.
Interesting. So you touched on this earlier, and I would like to circle back to it as we, really work to conclude this episode. But you talk about your need to be able to hear stories from employers, how this impacts them, what are these real life, scenarios. Can you share an example of, a client story that was shared with you that was impactful when you were meeting with lawmakers?
Yeah. So one of the things that I think you'll probably recall from the ACA was there was this concept called the Cadillac tax. And the idea was that, hey, employers are giving their employees these great benefits, and that's what's driving up the cost of healthcare. One of the realities, though, behind it that we know is healthcare costs and how much the plan costs is really contingent on a lot of different things. Location matters significantly. What the population is it an older population? Are there more women in the population? There's all these dynamics that are there. And so even if you can have a high cost health plan that doesn't provide all that extensive of benefits just because of the population or location or different other variables. And so we were pushing on members of Congress to understand that that the tax wasn't going to do what they wanted it to do. And so we were able to talk with several of our clients, use client data, obviously anonymized, unless there were a couple of clients who said, yes, attach my name to this. I want my lawmakers to know that this is going to affect me. And so we were able to go around with a packet of information and show lawmakers, specific companies and how the impact of the Cadillac tax would really drive up costs and make benefits worse for the people who actually needed it. And so we were happy to see successfully a couple of years ago the Cadillac tax was taken out, but it was really driven by using practical, real examples from clients.
Whether it's Washington State, Washington, D.C., or, any of the other states in between, we hear it time and time again and know firsthand that lawmakers don't really want to hear from insurance people, right? I mean, maybe there's this subject matter expertise that is helpful to them, but really the stories that change their minds and really impact their thought process is stories like what you have shared. So, we could consider this sort of a call out as well, that you want to hear stories from employers here as well. And here in the Pacific Northwest, we are going to be providing an opportunity for folks to join Scott, myself, other Pacific Northwest team to hear more on family leave as it's available. That would be an incredible opportunity for folks to join us and not only be able to ask questions real time, but perhaps also share some of your input with Scott at that time as well. Scott, I know you're on LinkedIn. You also have a podcast. Where can folks tap in and listen to your podcast?
We do. So I do a podcast with our head of compliance services, Ed Finchholt. The podcast name is Arissa is a Friend of Mine. Hopefully Arissa is a friend of yours too. And so we're on all the typical platforms. So you can find us there. You can reach out to one of us and we can make sure you get on the distribution list.
And I will say, I sing your praises and Ed's praises whenever possible. You both do such a great job of communicating this stuff in a way that's relatable. You don't have to have a law degree to understand where you're coming from or what it means. And, I know that takes a lot of practice to be able, to communicate that way. But I would just encourage, if you're in HR and swimming through this compliance stuff and always feeling like your head is spinning, Ed and Scott do a great job on Arissa is a Friend of Mine. So check that out and watch for some other opportunities to join us and learn more. That compliance team has also done an incredible job breaking down vaccine mandates, what it means, what to do and what to watch for. So I'd encourage you to connect with that. And I can help you get connected if you're not sure where to start. Scott, thank you so much for joining us and sharing what you know. And thank you for your work in Washington, D.C., because we know our voice matters and we appreciate you carrying that forward for us.
Thank you very much. Thanks for having me. And thanks for all the good work that you're doing, raising awareness and helping me do a good job by sharing stories that you've encountered.
Doing what we can, it matters, right? Democracy doesn't work if we don't actually participate, or so I'm told.
Exactly. I could do a whole podcast just on that, though.
Let's do it. I think we should. Well, thank you all for checking in today and engaging with us, listening to this. If you have feedback, if you have questions, I would love to hear it. Until next time, take good care.